This is Beauty and the Surgeon. I'm Dr. Jason Martin. I'm a board-certified plastic surgeon with Amy again, a nutritional therapist, a certified nutritional therapist. And we are talking today about the eyes. The eyes are probably the thing that bother people the most because it's the first thing to change with age besides the breast after pregnancy and the belly after pregnancy. And when you talk to people, we've said this many times before, you look people in the eyes or you look at people in the mouth. Or if you're my son, you look at the floor, which drives me crazy. So that's what we're talking about today is rejuvenation of the eyes. It's a complicated area of anatomy, right, Amy? So when we talk about the anatomy, Nils, our producer, is going to put the clock on, okay? And
you start getting all orbicularis oculi on us?
5 minutes at the most, because it will be a total snooze fest and no one will understand what I'm saying, to the point that the fellows, when they come in and rotate with me, I'm like, yeah, that's the septum, the what? That's the this or that. They don't even know, and they're studying the stuff before surgery. So we're not going to get too far into it. Let's get started. For people who care about the way their eyes look, what are the reasons that they come into our office usually?
I think most people start out with the textural changes in the area around the eye. So wrinkles, skin starts to lose a little bit of its elasticity, gets a little bit crepey, thinned out. Most people start with Botox, maybe do a little bit of filler.
And the Botox would be where?
Just around the eyes.
Okay, between the eyebrows, which is called the glabella, the crow's feet, which is on the outside of your eyes, and then sometimes even underneath your eyes a little bit.
A little bit. Yep, you can kind of sneak in a little. And the one thing, though, that people find with Botox in that area is it doesn't get rid of their wrinkles when they smile really big, because what's happening there is the muscles of the mid-face are pushing up on that area. So you can completely knock out the muscle around the eye. There's a circular muscle that goes all the way around the eye. You can put a lot of Botox in there and make it so it doesn't move. But when you smile hard, these muscles that lift your cheek up are pushing up on that skin and are going to continue to cause wrinkles.
Yeah, those muscles, zygomaticus major and minor muscle, are the ones that do that. So what you just tell people not to smile. That's what
I tell people. I tell them I have no emotions. When people say you don't have wrinkles there, I say it's because I have no emotions.
Because you do not smile.
I never.
If you want to smile, then you have to accept the fact that you're going to have
tape there.
Yeah, you have some wrinkles. I think someone had said that one of her doctors had injected those muscles, and I was like, that would literally cause paralysis of the edge of your mouth. Mm-hmm. And I would highly advise people not to do that.
Yeah, I would highly advise you not to do that.
Because there's a reason people don't like strokes, besides the fact that it's terrible. It makes your face look weird when it involves the facial muscles.
Drooling.
So, okay. So definitely Botox. So they come in textural changes, some crow's feet, the 1s, 2s, and 3s, whatever they call those, between the eyebrows. The wrinkles there, that's where Botox really helps. Mm-hmm. And that usually starts, in most cases in their 30s, right?
Yep. Yeah. And it does help. And starting Botox sooner in those areas is obviously going to help more than if you wait until you're 50 or 60 and all of a sudden think that Botox is going to fix it. At that point, we'd tell you not to waste your money on Botox. It's not going to do anything.
Right. So how do people
it's
know?
Gotten too far.
How do people know when it's time?
For?
Surgery. For the eyes.
So that's a good question. And it's a little bit different for everybody. I would say for eyelids, the upper eyelids, that is probably a sooner surgery than the lower eyelids for a lot of reasons. Mostly because once you start doing surgeries on any part of your body, specifically areas that are visible and are going to continue to change as you age. If you have a tummy tuck in your 30s, you're never going to need a tummy tuck again unless you gain weight or have another baby. You're good. You start doing your eyelids too soon, they're going to continue to age. You're going to continue to have issues with that. You're going to continue to want more surgery there. So timing it appropriately is good. Waiting until you truly are ready, but not waiting too long until it's a terrible problem is kind of the sweet spot.
Okay. So what are the problems that people usually present with that are fixed with surgery?
Of the upper eyelid specifically,
yep.
Yeah. Skin that is folding over or touching their eyelashes. Women can't put their makeup on anymore because there's no space.
Men have skin that's affecting their vision.
Men or women,
yeah. Their field of vision, basically the outside areas or above is usually what gets obstructed by the excess skin.
Yep, constantly looking tired. That just pulled down appearance of the upper eyelid.
Heavy eyebrows, or feeling that your eyebrows are heavy, that you always have to, and you see people come in, they're always lifting their eyebrows up.
Right.
I'm doing it now on the video if you're watching this, and I definitely need Botox, don't I? It's pretty obvious.
You need a little.
But that's what they do. They do this the whole time.
Right, they're arching their eyes to try
to just keep it open. Yeah. I think it's called Herring's effect or Herring's law or Herring effect. Your body autonomously actually is lifting your eyebrows up because that field of vision, it senses that and it wants to keep it open.
Yeah, you want that. I mean, like safety, right?
Safety, fight
Safety
or flight.
first.
Yeah,
yes.
exactly. So that's for the uppers. What about the lowers?
So lowers are a little trickier because those are areas that can be very genetically driven in their appearance, as can the uppers. But things that start to happen with the lower eyelids are dark circles, bags. Same thing with appearance of the fine lines and wrinkles, and then the crepiness. That skin just gets loose. It starts to lose its elasticity. So if you pinch it, pull it, it doesn't snap back anymore.
Yeah. A big thing is, especially for people who have any kind of skin pigmentation, is the discoloration along the tear trough. And that's not something that surgery really fixes. That's a lot of times what they come in for.
It is. A lot of people come in for those dark areas, like in the inner corner of the eye and just under that. Like they want to address those dark areas. And filler can address those in some mild way. Injecting a little bit of filler can kind of just give a little cushion, essentially, in between those underlying structures and the skin. Can kind of soften that appearance a little bit, but it's not really going to fix it.
Okay. So you do Botox for a while, and then you realize I have more problems. The Botox is helping, but it's not solving the problems. Excess skin on the upper eyelids, bagginess on the lower eyelids, and sometimes discoloration. So then you're going to see the plastic surgeon, and you're like, hey, am I ready for this? We think for the eyes that you should do it earlier rather than later for surgeries. Most of these surgeries we do in the office under local anesthesia, but sometimes we do it in the operating room. In general, in comparison to the other surgeries we do, they're not so costly that they're price prohibitive. But they definitely cost money. And there is a recovery. You definitely have bruising and swelling, but it's not so painful that you can't recover from it. So it's more of a social bruising and swelling versus like a painful bruising and swelling that's the worst pain you've ever had in your entire life.
Yeah, I would say in general, most people are not in a lot of pain after an eyelid surgery. It's uncomfortable that you can have your eyes feel dry, a little bit scratchy just from inflammation. Sometimes the inflammation kind of keeps your eyes from sealing all the way for a week or two, so your eyes can get really dry after surgery. That's probably the most common complaint after surgery, not pain. It's that their eyes are irritated or dry.
So let's talk about the anatomy. Nils, you have a watch? Okay. Does it have a timer on it? You have an old school watch.
I got two.
Okay, that's good. All right. So are you ready to talk about the anatomy?
Let's do it.
We literally have 4 minutes. I'm going to give myself 4 minutes. Okay.
Buzzer is ready.
All right, you guys ready? All right, so the upper eyelids, there's 3 layers. There's skin, muscle, and fat, right? So the skin is usually what we operate on in the upper eyelids, okay? There is a muscle that goes around the eye. It's a sphincter muscle called the orbicularis oculi muscle, okay? It attaches in the medial portion, which causes the medial canthus, or that's the tethering point on the inside of your eye.
By the nose.
By the nose. And the lateral portion, which is at the outside of the eye, it's a tethering point at the end of the eye. That's where you get that almond shape appearance of your eyes. The upper eyelids, we usually take care of the skin. The skin is what's excess there, and that could be because your brow is too low or you have excess skin there, or both. It's usually both. Also in the upper eyelids, there's fat. Fat hangs over too, and it bulges out. So we remove that fat. But the key is we don't remove too much, right, Amy?
Yes.
Because if you clean out the fat too much, not good. The fat is underneath the muscle, and you have to go through the muscle and the septum to get to the fat. Okay, so there's 3 layers. The lower eyelid also has 3 layers: skin, muscle, fat. The lower eyelid, the skin is always an issue, but we're usually less aggressive in terms of how much skin we take off. And on the lower eyelid, the fat is usually the problem. That's where you get the bulged out kind of bagginess of it all. So we're more aggressive with the fat in the lower eyelids than the upper eyelids, and we're less aggressive with the skin. There are a part of the eyelid called the tarsus. Okay, I'm going to use a sailing reference, and no one sails, but if you look at a sail on a sailboat, it has battens in the sail to keep its form, okay? That's what a tarsus is. The upper and lower eyelid on the edge near your whites of your eye have a support system called a tarsus that keeps the eye, that gives it stability. And that weakens over time too. So that's a really important structure that as you get older can weaken, and then you get deformities of the eye or problems with droopiness of the eye. That's basically the anatomy. There's muscles around the eye that move the eye in all directions. And there's bones around the eye that keep the eyeball where it's supposed to be. That's called the orbit. All these things in totality lead to what you perceive as your eye. Lastly, you see out of your eye. We're not talking about the anatomy inside the eye. So the nerves for the eye come out the back of the eyeball into your brain. How long did that take?
Oh, I'd say less than 2 minutes. Yeah.
3 minutes?
2.
That's good. I left out the hard parts, but fortunately no one really cares, so we got through it. So if you need surgery, let's talk about the upper eyelids, Amy. You can go through it. You've seen all these surgeries. So what do we do for the upper eyelids? Your skin's hanging over. You're like, I'm just not happy with the way it looks. What does that entail in terms of surgery?
So you said upper eyelid surgery is very frequently done in the office. It's an awake procedure. Takes about 45 minutes from start to finish. Hands-on surgery time is a little less than that. It's really easy. It's a small excision of skin.
You put the incision in the superior palpebral fissure, the depression above your eyelashes.
Right. So when your eye is open, you do not see the scar. It's where your eye kind of creases anyway when it's open.
Where your eyelid creases. And that crease can be different in terms of the person. If you're Asian, you may not even have that crease there. If you're older, the crease may be really high or up toward your eyebrow. In general, we would try to put the scar in that crease so when you have your eyes open, you can't see the scar.
Yeah, and even with your eyes closed after it heals, it's barely perceptible.
And the reason that is because there's a mnemonic or a saying in plastic surgery, which is thin skin, thin scar, right? So the thinner your skin, it's and that, by the way, on the eyelids is some of the thinnest skin in the entire body.
Yep.
And so that's why it's so mobile and easily moves around. So thin scar there, you don't see it.
Yeah, you have sutures for about 5 days, which people are sometimes surprised by. The sutures come out very soon after surgery. They don't stay in long because that skin does heal so quickly. It's very thin. It heals really fast. You can expect bruising even after an upper eyelid surgery that's going to settle under your eyes, like a black eye kind of appearance. Bruising is definitely...
So people always wonder, like, why am I bruising the lower eyelid? Because it goes down with gravity,
yep.
right?
And it sits along the bone.
Yeah.
It kind of gets stuck right there. So you can expect bruising even after just an upper eyelid procedure. Scar that is well hidden and once it's healed is barely visible even when your eyes are closed.
Okay. There's 2 fat pads in the upper eyelid, the medial, which is near your nose, and the middle. We tend to take more fat out of the medial near your nose. People have a puffiness there. We take that down. The middle one, we tend to not take out too much these days. They used to clean it out in the old days, but now we are really conservative with the removal, and sometimes we'll transpose that over and make it look better. Some people have droopiness of the upper eyelids. There's a muscle in there, which I didn't talk about in the anatomy part, which is the levator muscle, and you can pexy that, meaning that you can tighten it, okay? And those are, if you have a ptosis, which is droopiness of one eyelid over the other, you can arrange them out. That's usually done by an ophthalmologist, a person that does more reconstructive work. I was trained in those kind of surgeries and do some of those sometimes, but if it's severe, I'll send them to a specialist that deals with lid ptosis.
Yeah, oculoplastics or
oculoplastics,
similar. Sometimes if your ptosis or if the skin really hangs, like not just over the center of your eyeball, but if it's really hanging out to the side, we will sometimes sneak that incision out a little bit farther, almost like...
into the crow's feet.
Yep, into a little wrinkle.
Yeah.
And it's there again. Once it heals, it's not going to be visible, but you do sometimes have to take that incision a little bit outside the eyelid itself.
And it's not uncommon for us to both do an upper eyelid blepharoplasty or eyelid rejuvenation procedure in the upper eyelid and also a brow lift. So if you have really heavy brows and heavy skin, we can take the skin off and lift the brows at the same time. All these surgeries, I didn't say this before, are really dependent on the person's technical skills, the surgeon, because you can't, if you excise too much skin in the upper eyelid and then lift the eyebrows, you're going to look odd.
Well, and you won't be able to close your eyes.
You won't be able to close your eyes. So someone said to me once, they're like, so how do you know what to do? I'm like, well, I do the brow lift first, right? And then do the skin excision afterwards. And so I'll do the brow lift first, check my markings, and then do the skin excision afterwards.
Yeah, and that's an important thing to note too. With people always want like the most aggressive approach with surgery sometimes, and it's not always the best. And with the eyes, it's especially not.
So, rule of thumb for the eyes: be conservative, especially on the lower eyelids. And that's really it on that. So besides the ptosis stuff, and then every now and then there's something where the gland. Lacrimal gland, which is the eye itself, the eyelids encompass the globe or the eyeball, and they moisten the globe. So that's how you don't have dry eyes. And that moistness comes in part from these glands that are in the eyelid, but also from this lacrimal gland that's on the edge of the eye, and that keeps it moist. So sometimes those glands can descend or be visible, and you can pexy those back up.
Yeah.
I did have one plastic surgeon who told me that everyone needs a lacrimal gland pexy, and I was like,
No,
they don't.
No, do
but
they, though?
I didn't argue that with him. I just conceded that point and walked away and be like, I'm never having that conversation with him again.
Well, don't let him do my eyes.
Exactly.
Yeah.
All right, lower eyelids.
So lower eyelids, there's a couple of different things that can be done there from a surgical standpoint. We're talking specifically about surgery for this area. So some cases, we only need to take the fat out.
And that's usually done in our hands through a transconjunctival approach, which means on the inside of the eyelid. So you literally have no external scars.
And in some cases, we don't even do an upper on some patients. If they just have that really bad poochy under eye, especially if someone's probably under 45, you can just go in, you pull that fat pad out. Now, this is typically done as an asleep procedure in the OR because we are going in through, the eyelid.
But you can do it in the office. You numb up the eyes, you put an eye shield in, and you can do it. Listen, you can. When you give me that look, you're like,
would
no,
you like to
no, you
replay
can't.
the last time we did it?
No,
in
I
the
understand
office?
that. It is completely possible. There's some offices in this country that do it all the time in the office, right?
Yes.
And they'll give them IV sedation or oral sedation, and it'll be fine, right? But it's not always easy for people. People don't like their eyeballs being numbed up. They don't like eye shields on where they can't see, and they feel
They're
claustrophobic.
heavy.
They feel claustrophobic.
Yep.
So if you can, I would advise you just go in the operating room to have a more formal sedation or a operative facility, even if it's in the doctor's office, something where you get intravenous sedation.
So you can be asleep.
So that's the bagginess. There's a medial, middle, and lateral fat pad. So there's 3 fat pads below, and we almost always take out all of them, or a portion of all of them. And you can be a little more aggressive with the fat removal in the lower eyelid, and you want to be, right? The upper eyelid, you have to be less aggressive to avoid over-clearing out the upper eyelid and making it look skeletonized. Those transconjunctival approaches, small little incisions on the inside of the eyelid, the part you don't see. And you make a little incision, and it's one of the cooler surgeries that I do, and I go in there with this very small hemostat, which is this real small instrument, and I kind of tease out the fat and then pop it out. And it's always whenever the assistants are in the room, they're always like, wow, that's a really cool procedure. That's so awesome. Or they're like, oh my God, this is so weird. This is grossing me out. Like I'm looking inside the eye and this fat's coming out, whatever the case is. But when it's done, it's great. You definitely have bruising with that surgery.
Definitely have bruising, but your recovery is really easy. With that, it's very rare that people have any complaints about pain.
Right.
Some discomfort, yes, but not even really that much. I don't remember the last time a patient even really needed prescription pain medication after just that fat removal of the lower eyelid. It's just not that painful. It's uncomfortable, and you're going to be bruised.
One of the reasons to do a transconjunctival approach or from the inside of the eyelid is there's a septum on the lower eyelid that if you don't violate, according to what has been found historically, there's a guy named Dr. Jelks, Jelks, that I trained with, is if you don't violate that septum, then you will not, that you're less likely to have something called lid retraction or lid pull down or ectropion, all these problems after surgery. And people have seen people after these blepharoplasties, they look weird, their eye shape has changed. It's really important that you try to keep the almond shape of the eyes. And so doing the less invasive intervention, even though you're pulling out the fat, is better. And going from inside the eyelid is definitely better in that sense. If you have excess skin, then you come out on the outside of the eye and you remove the skin through something called a subciliary incision, which is right underneath the eyelashes.
Yeah, like right where the eyelashes meet.
So that's the one that worries people.
There.
Does that show?
No. No, it does initially.
Honestly? Are you being honest, Amy?
It does initially, yes. It absolutely does initially.
I'm just joking with you.
Because and a lot of times it's that your eyelashes are sewn down. Like we usually do a running suture right through there, so it's like it's kind of whip stitched your eyelashes all down.
And
so once that suture comes out,
surprisingly, you never see that. We do so many of these cases. We had a patient come in. I couldn't remember if I did she was far out. It was a long time, and I couldn't remember if I did that incision underneath or not. I just kept staring and staring. And I finally saw it, but you can't see it.
No, it really disappears.
It's almost imperceptible.
And you have the lashes, too, that are right there. That's what I mean. Like the lashes, once the lashes are popped back up from being sutured down, if they were, they hide it. There's a little shadow almost created by your lower lashes.
So what I'll do there is make that incision, and I'll take this excess skin out, and that's done very conservatively. I take more skin out on the outside of the eye versus the inside of the eye because then you have less likely to have lid pull down and problems. And then I'll support the lower eyelid by taking the muscle, the orbicularis muscle, and securing that to to the orbit, or the bony orbit. So these are all things that we do to make it better, and it definitely rejuvenates it. One thing we can also do is transfer fat from the fat pads, the middle, medial, and lateral fat pad, and put it along the tear trough. So that depression that's discolored right next to your nose that everyone hates, and you put filler in it all the time, we can actually transfer fat over there. So that's cool. It's a fat transfer. I like doing that. That tends to have a lot of problems if you don't do it correctly and if you're over aggressive. The fat doesn't make it, it can get hard and lumpy bump, and it's hard to remove it. So you got to do that conservatively.
Well, yeah, I mean, think about it. There's not much there. You're basically skin on bone with a very thin layer of anything else.
Also, what can happen, especially with age, remember we talked about the tarsus is the batten and the sail of the sailboat. That tarsus can loosen, and then the actual lid itself, the lower eyelid, can be loose. And if you take your lower eyelid right now, everyone watching on this podcast can take their lower eyelid and pull it out. Mine, even though I'm 45, snaps back pretty well. So I have somewhat of a youthful eyelid. Some people, when you pull it out like this,
It stays.
it stays, or it won't go back quickly.
Yeah.
And those kind of patients, you have to be very careful with surgery. Very, very careful. So some things we'll do is we'll do a lid shortening procedure in the lower eyelid to tighten that batten, to tighten that lid, okay? And that's done on the outside. There's different types of procedures. I don't want to go into all those. There's fancy names for those, and there's fancy instruments involved with those, which only nerd surgeons like to talk about. But you can tighten the lower eyelid and make it less redundant, and those are sometimes necessary. Also, what you can do is something called a canthopexy, which is the outside of your eye, the lateral canthus near the bone of the orbit on the outside of your eye, and tighten that lower eyelid, secure that lateral canthus to the bony orbit, to the bone. If you get more aggressive or you have reconstructive procedures, you can do that with things called mitex and all these other fancy kind of surgical procedures. It's very complicated and probably above and beyond this discussion.
Yeah, let's just talk about one of those, because I think it's probably the one other like kind of common thing that you see with aging is that as the fat pads shift around in the eye, sometimes the eyeball itself can kind of get an unusual appearance, the globe of the eye, as it kind of like sinks with the fat.
Yeah, it doesn't really sink. What happens is at least with age, you get an elevation of that superior palpebral fissure or the crease above your eye, and then it can actually look like it can change the shape of your eye, and it actually change what you perceive as where the eyeball is.
That's what I'm getting at. Yeah.
It doesn't really technically change,
No.
but it has a different appearance. Because if it did technically change, remember you have binocular vision. If you have one eyeball that's one area, one in the other,
I'd be dizzy all the time.
it would be terrible. So, and that's common after actually facial trauma, because you see that they have swelling and their eyeballs kind of get displaced. So, but it does look different.
Right.
And it can look recessed because you lose fat in that area. It can look asymmetric from one side to the other. The one thing I can tell you with the eyelids is that you cannot fool around with the eyelids. It's a hornet's nest. You always take the conservative approach. I tell everyone that.
Yep.
You can always come back for a later day. You don't burn a bridge, because the minute if eyes look weird, different, asymmetric, everyone notices.
Yep.
People can have a big birthmark on their face, and people don't even notice
Right.
it.
Like a terrible gobbler turkey
Yeah.
neck.
Like jowls that are going
Yep.
down to their shoulders, but like the eyes, we stare at the eyes and you can notice that. So always be very conservative with the eyes. Less is more, always. And you can do, we didn't talk about this as much, but we did talk about it in the last podcast, you can do resurfacing things around the eyes that are really
To help with the texture. Yeah, specifically on the lower part of the eyelid to help with that texture, absolutely. And I think it's important to kind of, what you were getting at just there is like once you've done, I always tell people with any surgery, you can never go back. But specifically with things like the eyes, because they are so pivotal to like our communication and like our understanding of other people by looking at their eyes. When someone's eyes look really disturbing, or like if they're too open, like if the part that's near your nose, that little triangle right there, if it's too spread, looks really weird. And that's what happens when people have had maybe too much or too aggressive surgery on that part of the eye.
So I can tell you in my life, when I wake up in the morning, I look at my wife's eyes to see what kind of mood she's in, and then I come in here and I look at your eyes and your body language, but your eyes too, and I'm like, okay, that's one of those days where I'm just going to go in my office and do my pre and post pictures. Yeah, but the eyes are just, I think, forewarning. And we've done that. We've dealt with that in our practice. Yeah. We've done things where we try to push the envelope, and it's been dicey.
Yeah.
And surgery is an art form. You learn from your previous experiences, but always be conservative if you can.
And be willing to try other things. Specifically, I think touched on a brow lift. If you've already had your upper eyelids done a couple of times, or maybe even just once, and like you still have some heaviness, what you need is maybe not another eyelid procedure. Maybe it's a brow lift.
Exactly.
You know, or even a mid facelift. You're like, maybe some of the issue that you're having is not so much the eyes itself, but the structures around it
Right.
that are giving you an aged appearance that you don't like. And that's where consulting with a board certified plastic surgeon is going to give you some insight into what the rest of your face is looking like.
Or oculoplastic surgery.
Oculoplastic as well. I mean,
Yeah,
that's
excellent.
all they do is
Yeah.
head up
Yeah.
or neck up.
They're legit.
Absolutely.
Most of them.
Yeah, but if you've had a great oculoplastics, I mean, absolutely, they're going to lead you in the right direction. But they're going to look at your face as a whole instead of just focusing on the thing that you're focused on, which might be your eyelids,
Yep.
and be able to say like, "Hey, you really just need a brow lift."
And that's a good point too. So just remember, beauty is about balance. People forget this. If you have a big turkey gobbler neck and really pug-like eyes, if you fix your eyes, you're still probably going to look a little older.
Mm-hmm.
So you got to fix the neck too, right? It's all in confluence. But we're okay with segmenting it out because a lot of people are like that in life, right? They don't want to spend a lot of money, or it's just not the right time.
Mm-hmm.
The eyes are a great place to start.
They are. Yep.
The eyes are always subtle if done correctly. If done correctly, you'll never look done or whatever
weird.
that weird. And people won't really know, but they'll say you look great.
Right. You'll look
And
more
say,
alert.
"Oh,
You'll look
I
awake.
I slept a lot. Went to
Yep.
vacation, lasers, whatever story you want to tell, or tell them you went to Dr. Martin.
Tell me you had a great surgery.
Yeah. But that's something you have to remember. So if you're going to invest in your eyes, you have to look at the other areas too.
And vice versa. I mean, we have a lot of patients. I'd say it's probably more common for patients to come in for facial aging. You know, they're all in on a face and neck lift. Like, oh, I don't want anything done with my eyes. You know, they're like afraid of that.
Well, for a good reason.
Yes.
Because they've seen the weird stuff.
They've seen bad stuff.
Yeah, I mean that's the problem with modern day media, and then like even our neighborhood, like Cherry Creek in Colorado. You think Colorado's supernatural? You walk around here, you see some weird-eyed people, and that sounds terrible. And it's not xenophobic. It's not people from different areas. I mean, it's like Caucasian Colorado people
Right.
with odd eyes,
Mhm.
and that's old school. That's not what we do now. It's totally different. So don't be alarmed. Go see someone like me. There's a lot of people like me out there. Someone who's going to be conservative but do all the new techniques and everything like that. Quickly, let's go through surgery. None of these surgeries take more than a half an hour per each area. So the brow lift is about a half an hour, 45 minutes.
And he's talking about the time it takes him to do surgery,
Okay, well,
not the surgical experience for the patient.
Do I care about the other stuff that's going on? It's about
no, but
what
a
I'm
patient
doing.
comes in like, Dr. Martin said those take 30 minutes. My ride's going to be here in 20.
Okay.
I'm like, well, tell
There
them
is-
2 hours.
There is other parts that I don't get involved with, which I think are ancillary, but I'm sure they're important, like the patient waking up and
Right.
stuff. Okay.
Well, I'm done.
All right,
30
so
minutes.
Surgical time, 30 minutes for the upper eyelids, 30 minutes for the lower eyelids at the most, and 30 minutes for a brow lift. So you could do your brow lift, eyelids, and lower eyelids in an hour and a half. Surgical time. And
OR time's going to be about 2.5.
However time yeah, exactly. Wake you up, that's your business. But so it's not a super involved surgery. It's very meticulous. It's very it's technique oriented. So you need to go to someone like our practice. We do this stuff all the time. When you go there on the day of surgery, if it's in the office or it's in an OR, it's all the same. You're going to get it marked beforehand with a marker on the upper eyelid. It's just going to encircle the excess fat in the lower eyelid. It's either going to circle the fat pads just to mark where they are, or do a line underneath the eyelashes for the lower eyelid, and that's called a subciliary incision. If you do it awake or asleep, in both cases we inject local anesthesia with some epinephrine, which helps with bleeding and bruising. And in almost all cases, especially if you're awake, you can inject enough local anesthesia where you have fairly good pain control.
For the uppers, absolutely.
Yeah, and even the lowers too, but you're going to feel certain things. So if you're squeamish or you don't like things, you don't like people touching your
Or
eyes.
you're claustrophobic.
Or if,
Yep.
like, what's the... they always do that, the optometrists. I hate it. They blow the air.
Oh, yeah, when they dilate your eyes.
No, but they do the
puff.
ocular pressure test.
Yeah.
Glaucoma test, yeah.
Oh, that drives me nuts. Does that bother you? And I'm numb.
Yeah,
And they have your eye wide open, and
Yeah.
then they just like they blow the air in.
yeah, I have brothers, so I guess maybe I'm used to like moderate
Okay.
forms of
They used
torture.
to pry your eyes open and blow in your eyes like forcefully.
No, I'm not saying they did that. I just feel like my tolerance to handle like weird, uncomfortable things is pretty high.
Yeah, I'm not sure if I could do. I mean, I think it's just me personally. I think I would just want to go to sleep. It didn't feel great.
No, I wouldn't
Yeah.
want to do my lowers awake. Absolutely not.
Yeah.
I'd do my uppers awake. but I wouldn't want to do my lowers awake.
External skin treatments are always a great add-on.
And those are things that are not a one and done. Those are general maintenance. You're going to keep needing those if you want to keep your results.
Botox is great beforehand, and you're still going to need it afterwards. So you don't get rid of crow's feet. You make them better, but you don't get rid of crow's feet by doing a brow lift or a blepharoplasty.
Right, because that anatomy that's causing those crow's feet is coming from lower down on the face.
And that's especially true in the glabella, which is between the eyebrows. That's the 1s, 2s, and 3s, or whatever Allergan has decided to say
The
this
11s.
now with their marketing. Okay. Whatever those are, those lines between your eyebrows that everyone hates. Our coach, Paul Ravella, I was watching one of his videos, and he has a real strong glabella fold.
Yeah.
And I just wanted to jump through the screen with Botox and inject them both hands, just to knock it out.
We'll just when you check in next week, tell him like, look, Paul, I noticed on your videos.
He looks great. I mean,
you need some Botox on your glabella.
It's more common, I think. I mean, you see it in men, that really heavy kind of between the
muscles.
eyebrows. Yeah. And Botox really works well there for men. The risk of these surgeries are pretty small, but they can be severe. If you have a severe bleeding episode after the surgery, there's cases where people have lost their vision. You can affect the muscles that move the eye, specifically during the lower eyelid procedures.
Dry eyes.
If
you have dry eyes before surgery, you're probably not a great candidate.
If you do have dry eyes, I probably would not do surgery on you. You would need to probably, if depending on the reason of your dry eyes, you do a supportive, like lid supportive procedure also to help the way that your lid lays on the globe on your eyeball. Those are kind of the main things. Infection is very uncommon. We've never had it. Bruising and swelling is 100% common. Discomfort is always there, but
let's talk about with the sclera. Like if someone gets, because that's really disturbing to people, and it does happen sometimes.
So you get there's hyphemas. There's different medical names. So basically, you can get swelling, and also with the injection of the covering of the eyeball, it can swell up, and you get this weird swollen, kind of bloody looking.
Looks like your eye's bleeding almost on the inside. Like it looks really weird. And the eyeball itself looks just kind of puffy.
Just imagine every zombie movie.
Yeah,
you've
it's
ever
like
seen,
that, like hairy
where
eyeball.
They do the close shot on the zombie eyes.
It's like
that's
that.
kind of what it looks like.
Yeah. And people think it's never gonna go away. Like, but it's gonna go away, right? Like the reds, the white is like completely red.
Away.
Yeah, it goes away.
It's the same
and
thing.
It's not painful. It just looks scary.
It's the same kind of dynamic of the men we do liposuction on in the abdomen, and the swelling and bruising goes down to their scrotum and penis, and they think that their scrotum and penis is going to be that way forever.
Purple forever.
It's not, bro. Okay.
Men are so reactionary.
The eye, I get it, because it looks really weird.
Oh yeah, you look at your eyes, you look like a demon. You got this like red devil eye.
It's kind of like when sometimes you blow a blood vessel in your eye.
Yes,
but it has more of a swollen look to it.
Yeah, it looks puffier and like almost like really glossy. Yeah. Like people think there's something in there. Like they think there's like some gooey thing in there. I'm like, there's not. It's just swollen.
That's really it. There's not many other things that can occur. Things that could occur would be very odd and weird. The main thing you should be concerned about is your appearance afterwards. If someone is too aggressive, they take off too much skin, they take out too much fat, they overcorrect, or whatever. You can look odd afterwards.
Yeah, those things you
it's
can't
hard
go back
to come back
from.
from that. Yeah. You can do things to fix it, but it's not perfect.
Yeah, they're not easy. So the real solution there is to make sure you're going to either board-certified plastic surgeon, board-certified oculoplastic surgeon.
Which is basically an ophthalmologist. I mean, they always do their fancy words,
Yeah, they do. But making sure you're going to someone who really understands the anatomy of the eye.
Oculoplastic surgeon is an ophthalmologist who did an extra plastic surgery training.
Yeah, so they don't do body stuff. They just do stuff of the face and neck.
They're excellent, too.
Yes.
So we highly recommend those people, too. To be honest with you, I mean, if you just think about plastic surgery in general, I'm probably an outlier because I do so much facial rejuvenation that not all plastic surgeons are comfortable with those procedures.
Yep, that's true. If you go to someone who just does a lot of lower body stuff, keep looking.
If you consider the history of a blepharoplasty procedure, it was started by plastic surgeons like me. So the Greeks did it in 25 AD. I researched all this stuff. Then Avicenna was this guy in Persia in the 10th century. He had the canons of medicine. They took bamboo reeds and they would squeeze together the skin and let it sit there for 3 weeks and wait for the skin to fall off for people with heavy eyelid skin. And then in the 1800s, it was always like in Germany and places like that, they started doing more stuff related to heavy eyelids. And then it was the 1900s is where they started doing it for aesthetic reasons. And it was actually crazy. It was like in the 1920s, 1910, 1920s.
Yeah.
I was reading one thing where it was the first use of before and after pictures.
Was for eyes.
Yeah,
Well, but
for cosmetic surgery.
Yeah.
It was like in the 20s.
It just shows how important that is for communication.
Yeah.
Like it really is.
And then in the 50s and 60s, it became a lot more common, and now it's top 3 of the procedures we do. There's not huge surgical advances, no matter what people tell you, but it's really doing the less invasive options for the eyes and then combining it with other really cool surgical procedures of the face for rejuvenation. That's really it.
It's the eyes about it or something.
I mean, pretty much universally, especially for lighter skinned people, Caucasian people, the eyelids are going to be a problem.
Yep.
So you don't have to do anything. Again, it's a subtle change, and that's what I love about the surgery. It's also very meticulous. I love that part too. So people that want to come in and like, I'm going to do my eyes and I'm going to look like a totally different person. I'm going to look 20 years younger. It's not going to happen. But it's definitely that subtleness works in to your advantage done correctly.
Yeah.
Because people look at you and you're like, wow, she looks great.
Just looks
Or,
awake.
He looks great.
Yeah.
Yeah.
Well rested.
It's top 3. It's very common. We do it all the time every week. So if you have any concerns about your face, look at your eyes first, I think. And the surgery is going to a competent person is a quick recovery. You don't have to worry about much. It has a fairly low risk profile, besides a few things that are pretty uncommon.
Yeah. That's it. That's all I got.
Okay, that's all we got. So thank you for listening. Don't you want to say the things about rating and ranking?
Yeah, I'll say the things.
Yeah.
Be sure to check us out on social media. You can find us on Instagram at Jason Martin MD and also at Beauty and the Surgeon Podcast. Also on Facebook with those same names and online.
And we got our new website for Beauty and the Surgeon Podcast.
It's coming
out.
soon. BeautyandtheSurgeonPodcast.com. We're
Is it
super
going to have
excited.
under construction? I hate that when I go to a website and it says under construction.
Actually, right now it just says that it's owned.
Oh, it does? Okay. So that will be coming out. And we've hit on the topics of the eyes before about dermal fillers and stuff like that. So feel free to look back at our catalog. We have tons of stuff on facial rejuvenation, facelifts. We talk about the eyes there too. So it's related to everything else. We've talked about this before, but we specifically wanted to talk about the eyes. If you're considering this surgery, hopefully this was helpful. All right. Have a great day. Thank you, Amy. It was wonderful.
Thank you.
Bye-bye.